Did you know that many breast tumors are slow growing, potentially giving you time to explore alternative approaches? Today, I sit down with Dr. Toni Galardi, a licensed psychotherapist and author of Quake, 10 proven steps to healing and preventing breast cancer without surgery, radiation, or chemotherapy. Toni shares her personal journey of healing breast cancer holistically and offers insights into the emotional and psychological aspects of the disease. You'll learn about the connection between stress, boundaries, and breast health, as well as simple and affordable ways to support your body's natural healing abilities. Toni explains how detoxification and addressing emotional trauma plays a crucial role in recovery. Stay until the end to hear Toni's powerful advice on how to approach healing with self-compassion. You're listening to the Born to Heal podcast, and I'm your host, Dr. Katie Deming. After 2 decades of practicing as an oncologist and caring for thousands of patients, I've seen firsthand how our healthcare system places obstacles in your path to true healing. My guests and I will bridge the worlds of Western medicine and alternative healing to help you achieve optimal health. Expect to uncover new insights, share a few laughs, and maybe even shed some tears along the way. But most of all, we'll learn how to heal from within together. So let's dive into today's episode. I am excited today to be joined by Dr. Toni Galardi. Toni, welcome.
It is my excitement to be here.
I love it. I've been waiting to talk to you. So this is going to be really fun, I think, for both of us. Toni, I wanted to start just to have you tell us a little bit about who you are and, how you came into the work that you're doing, and specifically talking a little bit about your book, Quake, and how you came into working with that, doing that work.
Everything in both my personal and professional life really allowed me to take the kind of leap of faith that I took when I was diagnosed with breast cancer myself. I had written a book called The Quake Phenomenon, and it was all about helping people face catastrophic crisis and get out of the addiction to crisis before making changes. And my work is as a career purpose, helping people find their souls. So I'm not in the functional medicine field, but I had been studying functional medicine since the age of 30 and had gone through my own experience with Hashimoto's and a bunch of other immune-related things that I had gone to Optimum Health Institute 30 years before my breast cancer diagnosis, and had seen people through detoxification having miraculous recovery from cancer, which was not my diagnosis. When I felt this lump in my breast, and I thought, okay, I've got to, do the process here. Went through the mammogram and then the ultrasound and then the biopsy. And what was the turning point for me making the decision to do this completely holistically was the breast cancer surgeon here, Dr. LeBlanc, who's wonderful, pointed to the scan and said, oh my God, your tumor is in the shape of a heart, a cracked heart, where 2 tiny tumors had merged together. And I thought, and it was in my left breast over my heart. And I thought, okay, this is emotional because I was gluten-free, don't drink, all kinds of, like a really healthy diet, exercise, you name it, normal weight person. And and because I'm a psychotherapist and Jungian trained, I look at shadow. I look at what is it that's disowned? What is out of balance in your life? And started doing an excavation and just started interviewing women I interviewed everybody. I interviewed people who had done traditional lumpectomies because I had a stage 1 leading to stage 2 invasive ductal carcinoma. And so I wanted to be able to make an even-handed decision about this. And in the end, what made the most sense to me was to get to the root of what caused breast cancer for me, and do that excavation first, and to see if in doing that, this could get reversed. And it was. In 6 months' time, it was gone.
I love this. So, and tell me, because this is one of the things that I think people get really nervous about when they think about approaching healing cancer, specifically from a natural perspective. They're like, well, if I had let's say, Hashimoto's, or even though that's like serious, people are like, I'm not going to die of this. They think, okay, I have time to figure out a way to do this maybe more naturally.
Right.
But I'm wondering for you, did you make some kind of agreement with your doctors where you're like, I really want to do this naturally. Will you give me a certain amount of time? I'm just wondering if we can walk people through what that was like for you.
Absolutely. So the first question I recommend people ask, and I talk about it in Breast Quake, is this slow growing? 85% of breast tumors are slow growing. It's a very small percentage that are either triple negative or inflammatory in nature. Okay. So most of the time, but we need to find that out, there's debate in the holistic world as to whether you should do a biopsy because it can release cancer cells. But my feeling was I needed to know. I wanted to know how much time I had. And so when I said, is this slow growing? And she said, yes. And I said, so can you, because she wanted to rush me into an MRI. And I said, can you give me 3 months and let me see what I can do? And we can reconvene. And she said, yeah, we can do that. So that's when I went full board on doing detoxification. I did SEACT, which is wonderful. There's 100 years of data on that particular product alone in reversing all kinds of cancer. I did coffee enemas. That's not for everybody, but I wanted to stimulate glutathione in my liver because much of this can be an overloaded liver and colon. We're being exposed with environmental toxins all the time, which converts into xenoestrogen in the body, which is the bad estrogen, right? Not all estrogen is alike. And that's something I also, wanted to educate people in. So in that 3-month period, I started vitamin C IVs because there's tremendous research with Dr. Reardon he has compelling data on how efficacious vitamin C IVs, high dose vitamin C IVs are on breast cancer. And within 3 months, I went and did the MRI, and it had reduced by 70%. Now, here's what's an important piece that I had to do some research to really get the data on is that, and this is what my breast cancer surgeon told me, they can't tell the difference between dead cells and live cells. An MRI does not, for the most part, give them an indication, which is why when they do radiation after the lumpectomy, if it's an early stage breast cancer, they do radiation because it sweeps, it makes sure that it's dead. And they wait 6 months, right? Until they know and then look to see because we don't know whether it's dead or alive. So I could no longer feel this tumor. It was no longer there. So in my own personal opinion, it was already probably dead. And what was left, the 30% that was left may have just been dead cells. There have been, Nathan Crane on his summit talked about a woman for whom she got talked into having a mastectomy, even though she had done holistic stuff prior. When they examined the tumor in the actual breast tissue, the cells were dead, but you couldn't tell that from the MRI. So my feeling was that it was gone. That what was left was just the dead cell. So I continued doing detoxification, emotional work. I looked at childhood trauma that I hadn't cleaned up from growing up in a dysfunctional family and all the things traumas, losses in the past 5 years that had happened one after the other that I didn't have time to process. I did all that work, spiritual work, meditation, all kinds of things that I included in my excavation. And within 3 months, when we retested, it was gone completely. That's what the ultrasound showed.
Awesome. Well, and this, I think, is helpful for people just to think about a way, if they want to pursue a natural approach of how to do that with your doctors and with their, you don't have to go behind your doctor's back. Although sometimes some people feel like, oh no, my doctor wouldn't trust. Find a doctor who will work with you. But what you just described, I also just did with a client who they were recommending a mastectomy. She had actually metastatic breast cancer already and had been in remission for 2 years. It had spread to her lungs and everything was clear, but she had a new DCIS that arose in the same breast that she had already had a lumpectomy in. And so their standard was to recommend a mastectomy. And so she was planning for a mastectomy and on the path to go see a plastic surgeon to talk about reconstruction. And she ended up scheduling with me. And I was like, wait, time out. According to the Western paradigm, you have incurable stage 4 disease, according to what they believe. Why would they take your breast off for a DCIS, a stage 0? Right. So I asked her, I said, is your surgeon open to you trying, give us 3 months, like just 3 months, and then you can re-image and see what things look like at that point. And so we did that and did, the things that you're talking about. So my whole practice is about this. We're calming the nervous system, detoxing the body, nourishing the body with the things that it needs, which many of us are not getting in this day and age, and then aligning spiritually. And she ended up having her mammogram just about 4 weeks ago now, and they can't find anything.
Wow.
So I think this idea, and this is the thing where I think holistic treatments are the most helpful, is if you can do it up front before you get into doing the chemo. Because if we think about cancer as being an imbalance of increased toxicity in the body and lowered immune function for whatever reason, whether it's emotional stress or mental stress or not getting the right nutrients, when we start to put chemotherapy or radiation in our system, you actually worsen that balance, that you're actually worsening the issue. And then it can be even harder to do the holistic stuff. So I love this, that you're bringing it up about the option of saying, okay, do I have time? Can I explore another way before we jump into conventional therapy?
And there's another issue, which is sometimes, because I know one person, this was the case, who had the lumpectomy, but did not do holistic treatment. Okay. Just did nothing. And so therefore then the traditional medical community will come out and say alternative treatments don't work. Right. And had she followed up with alternative treatment, because it came back, it came back. So there is a big controversy right now. I don't know if you know about Elle Macpherson's book coming out in November they're skewering her in the press, about the fact that she didn't do traditional radiation and chemo. She actually had a lumpectomy, but she put a team together and could afford to do that. So what most women think is, I either have to do the full on, lumpectomy, radiation or chemo or whatever, or holistic, total, and there are lots of options, lots of to go here, depending on what you can tolerate in terms of your own ability to do stress management techniques, and look at a whole chapter in my book is on your career, because that can drive the problem. And if you don't address that, because there are careers that make you more vulnerable, to this cancer, specifically to breast cancer. And in fact, my gynecologist said to me, because I brought the book into her, and after I went through the whole thing, I reversed it, and she said, "Don't tell me that doctors are." I said, "They're pretty vulnerable." Yeah.
They have one of the highest suicide rates,
twice as likely as and any woman, by the way, in an administrative position who's got a lot of responsibilities. We care for people. Women care. So when we have to fire someone, for example, and you're in an administrative position, or someone, if you have a private practice, as a physician, and you've got all kinds of problems going on with your staff, all of that's extremely stressful because we care. And breast cancer, some of it is overextending, on a body psychology level. It's about not having great boundaries and overextending yourself to others. I was the eldest of 4 children, and was often, the one in charge. So that became a modus operandi, in terms of how I operated in my life, is always overextending yourself.
Hey, it's Dr. Katie. You may have noticed that I talk a lot about water on this podcast. After a year of research, I've learned that optimal water needs 3 key elements: filtration, mineralization, and structure, just like natural spring water. Doing all these steps to my own drinking water took me several hours a week. That's why I'm so impressed with Spring Aqua. Their system incorporates all three elements in one system that is basically modeling its technology after the renowned healing waters of the spring at Lourdes, France. I personally use their Wet 7 model, which offers alkalinized hydrogen water and saves me hours each week. Spring Aqua has dramatically improved hydration for both me and my family, and I believe it could do the same for you. I recently had the owner, Kenny Lou, on the show, and his integrity really shines through in this product. If you're interested in experiencing truly hydrating water that mimics nature's process, please visit the link in the episode description. Yeah. And actually, I want to come back to this point because I think my specialty, so in radiation oncology, was breast and gynecologic cancers. And then now in my current practice, I do see people with other types of cancers. And I did before as well, but my primary practice was those two. This is a real issue, the whole boundaries issue and the overgiving and the people pleasing and all of that. So I want to come back to that, but I also want to speak to what you just brought up with the Elle Macpherson, interviews and books. And I actually just recorded a video for social media about this. And I think this is the thing. And actually I was really frustrated by the doctor's responses. It's like, it's okay for people to share their story. There is not one way to treat cancer. Every single person is an individual. And you brought up a good point that maybe you do surgery and maybe you choose not to do the other things, or maybe for you, it feels right to do the radiation. I say this all the time. I don't have an opinion about what is right for your body, but what I would like people to know is what are the statistics? What is the data? How do I make good decisions so I understand if I do this treatment, these are the potential benefits and these are the potential downsides. And if you don't do it, I love that you brought up the whole thing of not doing anything, that the Western doctors, they think it's all a big black box anyway. And they're like, they don't do treatment. This person's going to come back and they're going to have a recurrence, which you're absolutely right. If you don't do anything different, nothing is going to change, and that it is likely that this is going to progress. So you can't not do the treatments and not do anything and expect a different result than what your body is already doing. If you have cancer, it means that your body is an environment that is allowing that to develop. So something needs to change if you're going to get a different result. And so I think it's this piece of where, and this is why I think there's such a disconnect, right, between the Western community and then the holistic practices. And then also the other thing is, now that I'm in the holistic space, it's a little bit like the wild, wild west, right? Because then you go outside of the protocols, which are, I think people in the holistic space are like, well, we don't want to just say this is the right protocol for everyone with this disease. But then it gets confusing, right? Because patients are trying to determine, well, how do I put together a team and how do I make decisions about my care? And it's very confusing because actually a lot of the people in this space are saying completely conflicting things. And so I think people get overwhelmed and then have a hard time making any decisions at all.
Yes.
And I think that if I could give advice to people about what are the important things to be thinking about, is that if you have cancer, you need to figure out what are the ways that you can detoxify your life physically, emotionally, mentally, and spiritually. And how can you start to get the nourishment that you need? And that can be as simple as like loving relationships and self-love, self-compassion, eating good foods that are not processed. It's just like so basic, but I'm like, if you could just get that, like those are the pieces that start to make us well. And it's less complicated than I think people are so, focused on. It's only this way, this protocol, this, you have to do it this way. And it's like, no, you're an individual. And I think, if you can use those principles when you start to look at other, practitioners and say, okay, does this make sense to me? Like, does this feel aligned? And then following it. So anyway, I just wanted to speak to that a little bit. And also with Elle Macpherson, I'm confused actually whether it's DCIS, because in some places it says stage 0, and then other places talking about HER2 positive, which HER2 positive is only reported in invasive disease. And in that case, then chemo would have been recommended. So there's some disconnect. But even if she said
she had invasive ductal. So I thought the article that I read said stage 1. No, so who knows? Okay.
Yeah. So anyway, but the thing is that say it's stage 1 invasive ductal with HER2 positive, which is I think what the doctors are getting so upset about. That's irresponsible for her to say that she did not receive conventional therapy, is like, but she did. Whatever she said she did. So this is her story. And you know what? She gets to share it. And that's okay. And she put together a team to do this. And we shouldn't be skewering her. We should be asking, what'd you do? Elle, what did you do? But it's so funny how the immediate response is like, oh, no, we shouldn't be talking about that. That's like, no, I think that's what we should be talking about.
One of the criticisms of, that, because I've looked at 3 different articles here, about this and about her book coming out, is that she had the money to put this kind of team together. And what was frustrating for me about this was I want to just go, there's a best-selling book out there right now that can show you how easy that just SEACT for those who can't afford to have a team that they put together. Not everybody can afford, holistic medicine. Going to see a holistic physician can be very expensive. And therefore, there are some other things. If you've got time, if you have a slow growing tumor, if it's small enough, you have got time to do things that will detoxify your body, like, certain teas and certain supplements. And we are living in a time now for everybody. I don't care if you have cancer or not. We need to be detoxing our liver on a regular basis. Seriously. The research I'm getting now, because there's a group called Moms Across America who had me come speak, and they really, and educated me on glyphosate exposure, how high in this country, not in Europe, they've outlawed it in the food and in the air and in the farming. But here in this country, we are just inundated with plastics in our food, plastics in our water, as well as glyphosate poisoning from things like Roundup. So as just a matter of course, to keep your body healthy, you have to be doing things that clean out your liver. And so there are some simple things that I talk about in this book that are not expensive to do,
Yeah.
With somebody who's got stage 3 or stage 4, there is a doctor in Santa Monica I went to who's an ozone specialist. He's an MD who does ozone. And he told me a story of a stage 4 breast cancer patient came to him. She had nothing to lose. They really didn't have anything more for her, but they could give her like chemo that would extend her life for a few months. It was in her pelvis. It was everywhere. And she thought she had nothing to lose. So she did ozone with him, high dose ozone for 4 months, 16 weeks, twice a week. And it completely, the body healed itself, according to him. So who knows? There are all kinds of things, but not everybody can go that route. And that's why I wanted to distill it down to what can people do that's not expensive if they don't have the money to see a holistic doctor.
Yeah. No, well, and even just water fasting, prolonged water fasting is
that's right. Yeah.
Remarkable.
And intermittent fasting. Yeah.
Yeah. But in terms of curing cancer, prolonged water fasting.
Yes.
Both of my clients who've had radical remissions and their tumors disappear without what you would consider adequate treatment conventionally, both of them did prolonged water fasting. So there's absolutely a lot of things that you can do naturally. And then also, I think this idea that there's just like one way, like ozone is one thing. And then we've got there's so many different things. And the truth is you don't have to do all of it too. I think that's the one thing that people get overwhelmed in their, clients who are working with me every day, they're sending me all of these different articles. And I'm like, let's slow it down. Let's focus on one thing at a time. And, you don't have to do everything out there. There's so many things and really putting together a protocol that works for you. But absolutely. And I do think that, conventional treatment is also expensive. Insurance pays for it, but a course of radiation is like, tens of thousands of dollars. And it's, when you have insurance, it'll pay for it. That's helpful, but these are not cheap treatments either.
The Journal of the American Medical Association, JAMA, okay? I put it in my book. It literally came out just before my book. I actually pulled the book back from the publisher and put this in. Quote from them. This is from a very traditional journal, right? Stating they are concerned about what it is costing to treat, and this is obviously traditional, treatment of breast cancer for women, that the cost is going, not everybody has great coverage. Some women have catastrophic coverage, $15,000 up front that they have to put out, number one, right? So they're concerned. They said that it is costing women more to treat breast cancer than the combination of colorectal, lung, and prostate cancer combined. This came out in JAMA. This concern, I thought, wow, that's great. I mean, they're actually seeing that this is getting to be really a very expensive kind of thing for women. And that's all I'm saying is that there are other ways. If you have a slow growing tumor and it's small, okay, you have time. If you can say to your doctor, can you give me 3 months? And by the way, so there's another piece to this, that there can be gender bias. One of the things in interviewing 100 women that I was looking to see how many women who had male doctors, breast cancer surgeons I'm talking about, who were supportive of them. And I found that although, if you see a female, just like if you see a male, this is what the tool they have for you is surgery, right? That's what they're trained to do, is surgery. However, female breast cancer surgeons seem to be much more collaborative about it, at least. I had 2 women I interviewed said that was it invasive ductal, or what's the one that starts with an L?
Invasive lobular?
Lobular, thank you. They had lobular, and they were told by their surgeon, you're going to die if you don't do this. If you don't have the surgery, you're going to die. Well, I didn't have that experience, And I don't know, but there can be this gender thing that happens between a male doctor and a female patient if you're not passive and compliant.
Yeah, I don't know. So I would say, just from my colleagues, I appreciate actually female surgeons because they think about how you're going to live with the aesthetics of the breast surgery. But I didn't see that as much in my practice with male surgeons pushing, treatments and that kind of thing. I think it brings up the point that your relationship with your doctor, whether it's male or female, is really important, having one that's collaborative. If you're interested in this approach, right? If you're just willing, if you're just going to go forward with what's recommended because that's what makes you feel more comfortable, then you're not necessarily worried about this as much. But I think if you're interested in pursuing holistic options, either complementary, like alongside conventional therapies, or to kind of try them up front before, you want to have a doctor who's going to listen to you. And I think the best way for me, I always think about, you want to talk to other people and find out their doctors, like if they like their doctors, and also who the doctors go to see. It's just helpful that way. But I'm not familiar with data around that particular bias of men, although it was definitely earlier in terms of mastectomy versus lumpectomy but that's been like now, 1980s or something, where we saw this big, but it was mostly male surgeons at that time anyway. I want to go to the question about boundaries and, this people pleasing, and maybe that there is something to this idea of, with breast cancer, that's, an issue that is a common thread for a lot of women. So I'm wondering, can you talk to us about this? Tell us, what you want people to know, and what about that have you noticed, and did you write about in your book?
So there is, in the women I interviewed, and a lot of women who are breast cancer, celebrities who've shared about their breast cancer journey, about how they had to learn about having better boundaries, that they were overgiving everywhere and taking care of everybody. And so there's that whole emotional piece as a psychotherapist that I work on with my clients, about how do they nourish themselves? How do they begin to put themselves first, because it's critical to their healing. But there's another piece that goes even before that. And that is, what is your relationship with your breasts? And that's why the first chapter of this book For me, it was about me looking at, wow, I had to really look at how much judgment since I developed breasts very quickly as a young teenager. And, you have boys doing cat calls and construction workers doing cat calls, and you develop a self-consciousness if you're big busted. Then there were women who I interviewed who felt judgmental of their breasts as teenagers because they were small breasted and felt insecure about that. And so there's all of this that goes into like, this is all, if we're 70% water, and Emoto's work on how we talk to water can create toxins in water. Yeah, they've done that. They've shown that through Kirlian photography, right? Mm-hmm. If we're 70% water, how we talk to our body or think about our body image. And so one of the things I started doing immediately was self-love, physically touching my breasts every night. And I still do it, loving them, and giving them the neglect I realized I had. We tend to think of breasts as something that nurtures the world, that our children are, whatever, men in our life, if you're gay or straight, it's part of the sexual piece as well. But how many women really think about, how do I feel about my breasts with me? How do I nurture my breasts? How do I appreciate them? Mm-hmm. How do I love them just the way they are, So that seemed important to me. That's part of the boundaries. But, it's like if I love myself and I love my breasts more, I'm going to be just naturally wanting to make decisions based on that, learning how to say no. Basically.
Yeah. Well, and actually, this is really important because one of the things, and actually when I was early in my career, so I practiced conventional radiation oncology for 20 years, but early in my career, I was like, if I was diagnosed with cancer, breast cancer, I'd be like, bilateral mastectomy, like take them off. I don't care. And I've seen so many women do that where they're like, oh, well, these are just problems. I don't need them because I'm not breastfeeding anyone anymore. Just take them. Right. And it really took me, practicing for a long time and then seeing the ramifications of those decisions that like your body hasn't failed you. Your breasts haven't failed you. And this idea of loving them actually, and I'm wondering if you can speak to this. And because sometimes I think it's hard for people if they have breast cancer mm-hmm. to love their breasts because at some level, and not all women, but this is something that I've seen is they feel like their breasts have betrayed them with the development of the cancer mm-hmm. and that it's hard to love it because of that it's allowed this to grow. And I'm just wondering what your perspective is on that.
No, again, because I'm Jungian and we look at shadow. And so how do you actually feel about the ugliest parts of yourself emotionally? How do you feel about your character flaws? Okay. Part of the healing when I take people on a journey in this world, in this realm, is about helping people to really own, first of all, their shadow aspects and embrace them and begin to love them. Because inside of them, like addiction, for example, how many alcoholics, I don't know how many of you've seen in your practice, who are in recovery will tell you alcohol was a gift because it took them to their spirituality. It took them, the addiction took them to their knees and they then had to reach out to God. Okay. So the same thing is true with an illness like cancer diagnosis, any cancer diagnosis. There's a gift. And I made that declaration. Like immediately I said to myself, I am going to find the gift in this. I am going to, as scary as it feels, this journey I'm going on, I'm going to get everything I can. Ram Dass once said, don't waste your suffering, right? Get everything you can from difficult things that come to you. So this is part of it is like, can you love this thing that feels like life-threatening, that feels so life-threatening? Can I love it? And that's a journey. It doesn't happen overnight. It happens through we do a lot of deep somatic work around this. Because again, this is in my world, this is how I look at it. It's a symptom. The tumor is a symptom. As you said in your own website, you go to the root of it. You want to see what the root of the cancer is. So we want to get to the root of it because there's the gift there. That's where the gold is,
Yeah. Yeah. And the way that it's funny because I feel like the gift can be triggering for people, that it's a gift that most of my clients, they get there, but it may be at first they're like, well, screw you for saying this is a gift because you know, like that whole thing. And, but the way that
you can't,
what's that?
You can't do that initially with somebody. I mean, I can do it with myself, but with a client, we have to go through the grief.
Right. Exactly. So that's what I'm saying is that the ones who are feeling betrayed, aren't there to get to that place. And the way that I talk about it is, that cancer is an opportunity to look deeper, to look underneath, like what is going on. It's brought about this crisis so that you can see it and you can heal it. And I love the way you're talking about the shadow aspects and, really accepting all of the parts and loving all of our parts. And this brings me to a question that it's been coming up with clients that I want to get your perspective on. And that is that, so in the, holistic space and where people are really clear on that our thoughts create and that they're very intentional about holding thoughts that are positive for their healing, envisioning their healing. One of the things that I see is people get so caught in staying in this positivity that they totally avoid doing the work that is necessary to actually work through the grief to get to a true place where you actually feel at peace and can be positive no matter what. And there's this pushback of like, well, I can't, so I ask, he's like, what are you afraid of? Like, what is the fear? And if we can work towards having peace with whatever your fears are, when you find that peace in your biggest fear, the healing happens naturally, right? And so I'm just wondering what your perspective is. And obviously, like, this is deep work, but this is something that I see a lot. And people are like, well, what you're saying doesn't fit with what I know about positive thinking and all this. But what I see is a disconnect where people are saying something, but underneath emotionally, they've got this turmoil and they're disconnected from it and they're ignoring it. And then you never really get to the other side when you stay in that space. And I don't know if that makes sense. Does that make sense?
Of course it makes sense. Of course it makes sense. One of my supervisors early in my career, when we were talking about the whole new spiritual psychology that was coming in, and he said, doing affirmation work without doing the emotional work is like putting cream, and these were his words, putting cream over shit, and I never forgot that you have to be, so the question I would, for your listeners, that if you are newly diagnosed, there is a way to be able to do a breath work exercise of going in and asking your body, what is this here for me? How is this here for me? What am I needing to discover? What am I needing to look at, perhaps, that I haven't taken the time to look at? And so for me, it was like trauma, like stuck, a breakup that I then left, California and moved to North Carolina. Didn't process enough because I had I had a book coming out. So I didn't do this deep processing. So what's the heartbreak that's locked in your body? They did a study in China and of women in their 40s, and they were looking to see what were the common denominators of women who got, because it's a small percentage in terms of all breast cancer diagnoses are women under 50. And although that's growing, and so they were curious about what was the factors? Was it socioeconomic class? Was it diet? Whatever. And the only thing that was the common denominator that kept coming up and over and over and over again was being in an unhappy marriage. And these were women in their 40s. So, you can feel trapped because you have children, right? And you may have teenage children. You may have aging parents, all this responsibility. So it's important to look at these existential factors in this and asking your body, am I in a situation that's not authentic for me? Is my body trying to tell me something? And so that exploration can be gentle. It doesn't have to be, it's important to be compassionate with yourself. So, so important to be compassionate with yourself throughout this entire journey, because it's nobody's fault. It's nobody's fault, but it can be an opportunity, as you said yourself. It can be a great opportunity. It was for me, and it continues to be.
Yeah. Well, and I think self-compassion, especially when we talk about this personality of people pleasing and overgiving and maybe, not great boundaries, we tend to be hard on ourselves, right? So we're so giving to everyone else, but then so hard on ourselves that self-compassion piece, especially with breast cancer, is so important. And that's even when I was practicing conventional medicine, I would always tell my patients, like, I want you to talk to yourself like you would your child or your pet or your best friend, because I bet you would not say the things you've been saying to yourself to any of those people. And they're like, of course not. I wouldn't say any of those things to them. And I was just like, you have to change. Like, we have to shift the patterns. And part of that is not only, giving so much to others, but really almost taking away from yourself in the way that you depreciate, or devalue what you're bringing to the world, right? You're here giving so much and then beating yourself. And I think that having compassion through this process is really important.
There's something else you're speaking to, which has to do with secondary gain. Like, okay, sometimes only way that a person, especially women, can give themselves permission to stop is an illness. Okay. And if you go the chemotherapy route, I understand that there are people who need to do that, if you have advanced stage cancer. However, there's a lot, I was aware of this because it was a lot of attention that people were giving me. And I thought to myself very, very vigilantly, do not get attached to the attention that this is bringing to you. Focus on your healing, focus on your deep dive work so that you don't bring this back again. And that's what Carolyn Mace, who is a wonderful medical intuitive, she wrote books with Norman Shealy, and she talked about in one of her books was, why don't people heal? Because there's secondary gain. It's the only way they know to stop, is if I get sick, then I don't have to clean the house and I don't have to go to this job I hate, because I've got a bald head and I have to be hooked up to a chemo, so they have permission, giving yourself permission to start resting more, taking naps in the afternoon. I come from an Italian, background. My father was an Italian immigrant, and we take naps in our house, and we know that really is medicinal, for example. So if you make these habit changes, then you don't have to either get breast cancer necessarily or bring it back, right? Because you're taking better care of yourself.
Yeah. Well, I can relate to that point of the only way that you can rest is for something to happen. And I remember thinking this when I was a resident. I had 2 babies during residency.
Oh my goodness.
And I remember thinking like, oh my God, thank God I'm going to deliver this baby, because then I can just like get out of the clinic and out of the hospital and just rest for a little bit. Obviously that was having a baby is like the last thing.
Wow.
It was like not restful at all. But I remember thinking that like, oh my gosh, I'll be able to stop for just a little bit, and I think that as women, this is a real thing that people aren't able to give themselves permission to say, you know what, I don't have to get sick or have something major happen to give myself permission to rest. And in fact, you need to rest. Otherwise, I forget where this quote came from. I had seen it from like a transformational coach, but it said something like, you can make time for your wellness or you'll be forced to make time for your illness, and it's really true. I think that idea, but I hadn't really thought about that and I'm sure it's unconscious for these women. They're not thinking like, I'm going to have breast cancer and then I can rest. It's like, no, this is happening on a subconscious level. And I just actually really appreciate you bringing up that piece.
Doing dream work with my clients helps a lot. And you can actually even prevent illnesses because we can see them actually in the dream time, you can get warnings, that something is amiss in the body. And so 90% of what's really going on with most of us is subconscious, but the dreams don't lie. So I would get information, with my clients that would tell me what was really going on that they weren't even aware of, So that shadow stuff, really important, really.
Yeah.
Wonderful. That's great.
Yeah. I mean, that was the way I knew that my mom died of ovarian cancer in 2023.
Yes.
And I knew she was dying from a dream. Actually,
Wow.
I saw it in a dream. She had basically like the lower part of her face was turning black and dying. And I knew that she was dying. And I asked my sister, like, what did and they said, no, her scans weren't scheduled for like a month. But then sure enough, at those next scans, it was clear that they were stopping all treatment and that it was done. But absolutely, we receive information in our dreams. And when we go to sleep, just for the listeners, the conscious mind, what is active during the day is offline when we're sleeping. And so then what you're accessing is pure subconscious, which is information. And so, I think there are techniques to getting good information from dream time, to make sure you're getting clear information, but it is very powerful. So I love that you use that. And obviously with Jungian, that makes sense that you're doing that kind of work. So that's beautiful. Well, I could talk to you literally all day because I'm fascinated by all of this. And it's just beautiful because you and I do similar work, like a lot of the work that I do is around emotions and the subconscious and, what is our body trying to tell us through this cancer diagnosis. Mm-hmm. But what I would love to have you tell my audience, and we'll include all of your links in the show notes, is where can people find you online and social media? And then your books, please tell us about your books.
Sure. So drtonigalardi.com, if there's going to be a Chiron for that, is the website. Quake is the most recent book I wrote, but there's also 2 other books I wrote that's about helping people find their true soul purpose if they're in career burnout. And Life Quake Miracle is the last book on that. So we get into a lot of exercises to help people find what they're here to do next. So that's, I guess, does that cover it in terms of? Yeah. I guess Instagram, you can find me on Instagram, Dr. Toni Galardi, Facebook, same thing. And I have a newsletter for people who sign up because I'm also a medical astrologer. And so one of the things that I can help people is with timing, when to make moves. And so I do a free newsletter that I send out every month. So if you sign up for that, you'll get some of that information too.
I love that. Well, thank you so much for being here and sharing all your wisdom with my audience.
Well, my pleasure, truly.
Thank you for joining me on Born to Heal. It's been a privilege to share this time with you. And I hope that today's episode has offered you valuable insights on your journey toward optimal health. Please consider subscribing, sharing this podcast with your friends, and leaving us a review. To learn more about how you can work with me, please visit katiedeming.com. You can find additional resources in the episode show notes linked below, and remember to join us next week as we continue to explore more holistic approaches to healing. Until then, this is Dr. Katie Deming reminding you that just like me, you were born to heal.